Welcome back to Living Local. It's hard to believe, but winter is just around the corner. It's about to get cold here, and with that comes ice and snow and greater chances of falling, unfortunately. So today we are talking about how we can prevent falls and actually how physical activity can help with that too. But joining us here in studio today, we have Melissa Engebretson in this segment, which is sponsored by Cottage Rehab and Sports Medicine. Thank you for being here.
Thank you for inviting me.
Yes, important topic, especially as we are leading into these colder months here. Why is fall prevention so important?
Well, anyone can fall, but as we get older, our risk increases. 36 million people over the age of 65 will fall each year. 3 million of them will wind up in the ER, and some of them will be hospitalized. So 20% of all falls result in some type of injury, and it can be as mild as a broken wrist or a sprained ankle, but it can be as serious as a head injury or a fractured hip that requires surgery.
So if we can prevent any of that from happening, that would of course be a really good thing. Are there any medical conditions that maybe increase somebody's risk for falling?
Yes, if you have diabetic neuropathy, you have limited sensation in your feet, so you could easily misjudge the surface you're walking on. So this is problematic if you're trying to navigate stairs or uneven terrain. If you have any type of dizziness or heart issues that cause a drop in your blood pressure, you're at an increased risk of falls. If you have any kind of arthritis, a lot of times it hurts to move. So these people will tend not to walk or tend to move, and they get tight and inflexible, and that increases your chance of falling as well.
Okay, so definitely some conditions that people should keep in mind as we get into this colder season with more risks altogether. Now, how does a person know if they are actually at risk for falling? Is this something that they can talk with their doctor about, or?
Well, first of all, if you've already had one fall, you're at increased risk of falling. And if you have an overwhelming fear that you're going to fall again, that's a risk. These people tend to change the way they walk walk less, and they stay inside their home. And this leads to further deconditioning and depression because of lack of social interaction. So you want to make sure that you are assessing anything like this that will prevent you from, not getting out of your house, and you want to basically take care of yourself. So.
Absolutely. Now, where does physical therapy come into play with all of this?
Yes, so basically you want to make sure that you're assessing all of your risk factors. So such things as having lower extremity weakness, having any certain kind of gait or balance disorder, dizziness, a decline in your vision and hearing can also impact you as well. So.
Absolutely. And what are some things that, well, I know you just listed, knowing those risk factors is so critical as you are trying to prevent those falls. Are there any other things that people can be doing to prevent falls?
Yes. So you can look at your home environment. First of all, it doesn't matter how old you are, but if your environment is cluttered, you're going to have an increased chance of falling. Basically, as well, too, is you can look around your house. Are your stairs and your hand railings, are they sturdy? Is the area well lit? Make sure that you have grab bars by your toilet or in your shower. You have anti-slip mats. And lastly, beware of your pets. I've had several patients I've seen that have tripped over their cat or dog that was weaving in between their feet. So.
Out on an adventure, but it's not always helpful. So really, safety, looking at safety measures is a really good way to help prevent all of this.
Yes, and so what we basically recommend is take care of yourself. So get your vision, your hearing, get your feet checked, as well as exercise and movement. So that's where physical therapy comes into play, because we want you to be able to lead a healthier, happier, and more active lifestyle. So in order to stay physically strong and mentally strong, you need to be active. So basically what you can do is you can talk to your physician, and we also have what's called direct access in both Illinois and Iowa. And a physical therapist will do an assessment on you. They will look at your strength, your flexibility, your posture, your balance and gait, and have specialized tests to determine if you're like a low, moderate, or high risk of falls. and then they'll make like a unique program. They'll create a program that's specific to you, and they'll teach you the tools so that you can be safe at home as well. So,
and really just helping with somebody's quality of life, so important. Now, lastly, before we go, you have an event coming up.
Yes.
Share those details so
Yes.
that way people can come out and help.
Yes. So all of our clinics have what's called a free screen. So if you have any kind of issue, pain, or a condition, you can come in and we'll take a look, and then we'll give you a best course of action. But on Wednesday, October 27th, in our Galesburg office, we have a free screen day. So all day you can call us now, make an appointment at 309-343-3434, and we would love to see you.
Okay, there's that number on your screen there too. All right, well, thank you so much for stopping by.
Yes, thank you.
Very good information to share with folks, and
Thank you.
hopefully it will help keep somebody safe too.
Yes. Thank you very much.
Again, this segment was sponsored by Cottage Rehab and Sports Medicine. For some more information, you can visit cottagerehab.com, and you can also find all of that information too over on our quadcities.com.